examination of the neck. As we ENT used to examine the patient in an examination chair face to face, we also examine the neck from the front in this position. We should go systematically, probably from the occipital region of the neck towards the anterior parts and the inferior regions and levels. First, we should examine with both hands and all the 10 fingers in order to palpate correctly the nodes or mass lesions. First, we should check the occipital region, the corresponding skin of the scalp, rubeola or scabies can give enlarged lymphatic nodes here. Afterwards, we should check the post-auricle region or retro-auricle region. Also, these regions can have corresponding scalp skin lesions, and the parotid region, which is in front of the auricle, corresponding scalp, skin, parotid itself, or external otitis, or even conjunctivitis can cause lymphatic node enlargement. The rest of the neck should be systematically palpated. A good landmark is the sternocleidomastoid muscle, the trapezius muscle, and the clavicule in the back forms the so-called posterior triangle, which is also called level 5. In the upper part of level 5, which is called level 5A, lymphatic drainage arises from the nasopharynx. The boundaries of this level, as I said, is sternocleidomastoid posterior edge, trapezius and clavicule. Accessory nerve running across divides it to a level 5A and 5B. Next, we should palpate the submandibular and submental regions. These are level 1. Mandible, hyoid bone, and the myohyoid muscle forms the boundaries of this region. The submandibular region collects its lymphatic drainage from the facial skin, the eyes, bucca, cheek, the submandibular glands, teeth, gingiva, whereas the submental region collects its lymphatic drainage from the anterior part of the nose, upper and lower lips, mentum, teeth, floor of the mouth in the front, and inferior surface of the tongue, and also the tip of the tongue. They form level 1B and 1A together. Next, we should palpate the parajugular region, which is locates between the larynx and the sternocleidomastoid muscle along the carotid sheath and the jugular vein. These are level 2, the upper parajugular, level 3, the middle, and level 4 is the lower parajugular lymph node. Lymph node in level 2 is also called Kuttner's lymph node, and it collects its lymphatic drainage from the mesopharynx, hypopharynx, and supraglottic and glottic region of the larynx. And they also form secondary lymph node to preauricle, retroauricle lymph nodes and to level 1A and B lymph nodes. Lymph nodes in level 3 and 4 are secondary lymph nodes to level 2. So they collect their lymphatic drainage from level 1, 2, and then it drains to level 3 and 4. They do not have their primary lymphatic supply. Next, we should examine the anterior compartment of the neck, which is level 6. Larynx, thyroid, upper part of the esophagus, and trachea lies here. In the midline, we can palpate the Adam's apple. Around it, you might palpate the Delphian lymph node, which collects its lymphatic drainage from the anterior commissure of the vocal cords. Most important structure in this region is the thyroid gland, which should be palpated. If any lumps palpated, it should be well assessed. We should ask the patient to swallow and palpate any mass lesions. In case the mass moves as the patient swallows, it means that the mass is either attached to the thyroid gland itself, or it is the thyroid that we palpate, or any mass lesions inside the thyroid gland. So it is important to ask the patient to swallow while we are examining the anterior compartment of the patient's neck. Next, we should check the supraclavicular region of the patient. On the left side, if a node is palpable, then it's usually called Virchow's lymph node, usually a tumor arising from the stomach. A Krukenberg's tumor gives metastasis to the supraclavicular region on the left side, but the breast cancer, lung cancer, and ovarian cancers can also give metastatic lymph nodes to the supraclavicular region on either side. As I said, we normally, as an ENT doctors, examine a patient from face to face, from the front, but it is also recommended to check the patient's neck from the back. In this case, we should ask the patient to sit out on another chair, and we should go behind the patient and do a systematic bi-handed palpation on both sides with using all the 10 fingers, and we should go systematically either from the front to the back or from the back to the front, superior to inferior direction. It depends, but the most important is to palpate all the neck levels and also the additional regions. So all the 6 neck levels should be palpated, and we should document if we feel any lumps or bumps in these regions. So level 1 is the submental and submandibular region. Level 2, 3, and 4 are the parajugular regions, which are the upper, middle, and lower parajugulars. We should check the anterior compartment of the neck, which is level 6 with the thyroid gland, and we should also ask the patient to swallow while we palpate this region, and also we should check the level 5 and the supraclavicular region. On the picture you can see that I'm moving the patient's throat side to side. Normally you should feel a crepitation as the posterior edge of the thyroid cartilage bumps along the vertebra of the patient. In case there is a mass lesion or a swelling between the larynx and the vertebra of the patient's neck, then this crepitation is not felt, and in this case we should suspect that there is a swelling or edema or maybe a mass lesion pushing the larynx to the front. In case no crepitation is felt while moving the larynx side to side, it is considered abnormal. There is an additional level which is called level 7, which is the upper mediastinal region. Details of level 7, please refer to the textbook. Thank you for your attention.